What is wide-awake hand surgery? Wide-awake hand surgery is performed purely under local anesthesia. It has been pioneered by hand surgeons throughout the world, including Mr. M.S.K. Bismol. It is now the norm in Canada thanks to the work of Professor Don Lalonde. For further details, please see the World Wide Awake website at www.worldwideawake.net. Wide-awake hand surgery is performed without the risks of general anesthesia, regional anesthesia, sedation, or tourniquets. The local anesthetic is used to anesthetize the skin only. Hence, the patient's surgery is performed with a moving and sensate hand. This has potential advantages for the surgery and recovery. Awake hand surgery potential advantages include convenient, can enable patient-centered pathway, can enable accelerated rehabilitation. Awake patient with moving sensate hand. This way the patient sees the problem and how it is treated. This can help in rehabilitation. There is no rehabilitation downtime on account of the anesthetic. Exercises can be taught while visualizing relevant anatomy. Dynamic feedback with active movement can help the surgeon fine-tune the results. One-stop wide-awake hand surgery, OSWA, was pioneered by M.S.K. Bismol in 1999. One-stop wide-awake hand surgery is wide-awake hand surgery performed in one stop. During the one-stop wide-awake hand surgery management stop, the patient has assessment, informed consent, surgery, and rehabilitation. All of the above is delivered within 30 to 45 minutes total. One-stop wide-awake hand surgery has treated several thousand patients with published peer-reviewed outcomes and 99% satisfaction. Carpal tunnel syndrome. The median nerve is a major peripheral nerve which runs through the carpal tunnel in the wrist. The carpal tunnel is a normal anatomical space through which the median nerve and the flexor tendons run. The roof of the tunnel is formed by the transverse carpal ligament. In carpal tunnel syndrome, the space inside the tunnel is reduced and the nerve is compressed. If you have tingling, numbness, and pain in the thumb, index, middle, and the adjacent half of the ring finger, you may have carpal tunnel syndrome. The symptoms are often worse at night. Carpal tunnel syndrome, pain, tingling, numbness, and pins and needles as shown here. Wide-awake carpal tunnel decompression. If more conservative measures fail, and if the symptoms are interfering with your life and activity, then wide-awake carpal tunnel release surgery may be a good option. Carpal tunnel release, decompression surgery, involves release of the roof of the tunnel, the transverse carpal ligament, shown in green in the diagrams. Throughout the world, hand surgeons are evolving to wide-awake carpal tunnel release, and our one-stop wide-awake service has an almost 15-year experience of this procedure. Three components of carpal tunnel syndrome. Sensory, pain, tingling, numbness in the hand as shown. Motor, weakness then wasting of thumb, base, thenar muscles. Autonomic, alterations in skin, sweating. Thenar, or thumb base, muscle wasting is a late consequence of carpal tunnel syndrome and is usually irreversible. Wide-awake carpal tunnel release. Surgeons throughout the world are evolving to wide-awake hand surgery. At the one-stop wide-awake service, our surgeons have been solely utilizing wide-awake hand surgery techniques for almost 15 years. The original one-stop wide-awake service was established in 1999 by Mr. M.S.K. Bismol. In 2011, he was joined by Mr. Q.M.K. Bismol. In 2013, Mr. Bismol moved their one-stop wide-awake service to the most appropriate location, the beautiful and bespoke QASMC off Harley Street in central London, UK.